Welcome to Supplements Demystified. In today's video we will be talking about collagen. We are going to cover why it's important for health, how it prevents disease, improves performance and how to supplement it effectively. Collagen is one of the most abundant fibrous structural proteins in the body and serves a variety of mechanical functions in all mammals. It is found in skin, arteries, cartilage, hair, nails and bones. The majority of collagen is made up of the amino acids glycine, proline, and hydroxyproline. These three amino acids are combined in various ways to form three strands which are then coiled together to form triple helix structures. So far 28 different collagen proteins have been identified. Each type of collagen is located in different parts of the body, and has its own interactions with other proteins in cells. We are going to cover the 5 most common types found in collagen supplements. Collagen type 1 is found mostly in the skin, tendons, blood vessels, lungs, heart, and the organic part of calcified bone and tooth tissue. Collagen type 2 makes up the majority of the skeleton during early development, but in adulthood, it is mostly found in the spine, joint cartilage, the retina, sclera and the lens of the eye. As a major structural component, type 3 is found in hollow organs such as large blood vessels, the uterus, and the colon. It also interacts with platelets during the blood clotting process and acts as a signaling molecule during wound healing. Type 5 collagen is required for the formation of types 1 and 3. It can be found in the bone matrix, the corneal stroma, the muscles, liver, lungs, cell surfaces and the placenta. Collagen type 10 promotes the formation of new bone in articular cartilage. Collagen comes from a variety of sources, including cows, pigs, chickens, fish, and eggshell membranes. Today, the majority of collagen is extracted from animal tissues via chemical and enzymatic hydrolysis. Hydrolyzed collagen is easily digested, absorbed and used by the human body. It has no odor or color, doesn't cause allergies and is easy to take in therapeutic amounts. Because it is tasteless, it can be added to any drink like coffee or juice. Hydrolyzed collagen has been shown to reverse and repair skin damage caused by aging and sun exposure. According to the findings, taking collagen orally transfers biologically active peptides to the skin, stimulating fibroblast migration and growth. When dermal fibroblasts are stimulated, they produce collagen, elastic fibers, and hyaluronic acid, which all help to hydrate and repair skin. A study out of South Korea evaluated the effects of marine collagen on human skin hydration, wrinkling and elasticity. 64 female participants were divided into 2 groups and received either 1,000 milligrams of collagen daily or a placebo for 12 weeks. The researchers used both visual assessments by dermatologists as well as high-precision instrumental analysis to measure skin parameters throughout the study. The women taking collagen experienced a 3-fold increase in skin hydration, skin wrinkling improved 10-fold, and overall skin elasticity improved as well. A clinical trial out of Germany performed a study on the effects of a bovine hydrolyzed collagen supplement combined with vitamin C, E, zinc, biotin, and acerola fruit extract. 72 healthy women aged 35 and up were given either 2.5 grams of collagen combined with a vitamin complex or a placebo. The researchers carried out skin quality measurements with both objective and instrumented methods, including skin hydration, elasticity, roughness and density. At the end of the 12-week trial, all skin quality measurements, both objective and subjective, improved in the group supplementing with hydrolyzed collagen. Also, the benefits lasted for at least 4 more weeks after the supplement was stopped. Multiple high-quality studies have shown that hydrolyzed collagen may help cartilage regenerate by stimulating chondrocytes and inducing the synthesis of cartilage matrix. A study published in the Journal of Agricultural and Food Chemistry examined the effects of hydrolyzed type 2 collagen on osteoarthritis. The trial involved 80 individuals with osteoarthritis of the hip and knee joints who were between the ages of 40 and 70. For 70 days, the participants were given either 1.2 grams of hydrolyzed type 2 collagen combined with 400 milligrams of chondroitin and 200 milligrams of hyaluronic acid, or a placebo. The researchers examined pain, disability, and joint stiffness throughout the study. Hydrolyzed collagen reduced pain in the knee and hip joints significantly more than placebo. A study published in BMC Nutrition Journal investigated the efficacy of undenatured type 2 collagen on knee osteoarthritis. 191 volunteers with moderate to severe osteoarthritis were divided into 3 groups. For 6 months, the first group received 40 milligrams of undenatured type 2 collagen daily, the second 1,500 milligrams of glucosamine mixed with 1,200 milligrams of chondroitin, and the third a placebo. Pain, stiffness, and physical function scores were tracked. At the end of the experiment, only the group that took collagen had much better knee function and less pain and stiffness. The group taking glucosamine and chondroitin had no significant improvement compared to the placebo. Hydrolyzed collagen may also be effective for treating rheumatoid arthritis, which is an autoimmune disorder that causes joint degradation. Multiple studies show that type 2 collagen works as an oral tolerance agent that changes the immune response in the body and stops pro-inflammatory immune cells from damaging cartilage. The Journal of Arthritis and Rheumatism published a study which investigated the benefits of cartilage-derived type 2 collagen in individuals with rheumatoid arthritis. 274 participants with active RA participated in the 24-week clinical trial. The subjects were given doses of type 2 collagen ranging from 20 to 2,500 micrograms. While all patients treated with collagen had an improvement in symptoms, the researchers discovered that the smallest quantity of 20 micrograms was the most beneficial and that increasing the dose diminished the favorable reaction in patients. The research indicates collagen proteins generate T-regulatory cells, which have immune suppression effects and lower inflammation. The study concluded that type 2 collagen, even in very small amounts, can modulate the immune response in rheumatoid arthritis. In a separate 24-week study, researchers compared the efficacy and safety of type 2 collagen with immunosuppressive treatment for RA. This was a large-scale trial in which 503 rheumatoid arthritis patients aged 18 to 65 were given either 0.1 mg of type 2 collagen daily, or a once-weekly 10 mg dose of methotrexate. At the conclusion of the study, both groups experienced a large reduction in symptoms. The methotrexate group did significantly better, beating the collagen group overall. The study found that type 2 collagen was not as effective as an immunosuppressive treatment, but it still provided a significant improvement in symptoms and had fewer side effects. Collagen intake is critically important for bone health since it makes up more than 90% of the organic matrix of the skeletal system. The bone matrix is a two-phase structure with the minerals providing stiffness and the collagen fibers providing flexibility and toughness. To put it simply, collagen fibers create the scaffold for cells and other components, whereas bone minerals contribute to rigidity. Studies have shown that collagen, calcium, magnesium and vitamin D all work together to improve bone strength. A study out of Germany investigated the effects of collagen peptides on bone mineral density in postmenopausal women. The trial involved 131 women between the ages of 46 and 80 with clinically diagnosed reduced bone mineral density of the lower spine and hip. The participants were split into two groups and received either 5 grams of collagen peptides or a placebo daily for 12 months. The researchers found that at the end of the study, the group supplementing with collagen had bone mineral density increase by 3% in the spine and 6.7% in the hip, while the group getting the placebo treatment lost bone mass. Blood samples were analyzed and revealed that collagen peptides were actually able to stimulate bone formation and prevent bone loss. In addition to being an effective treatment for arthritic conditions, collagen seems to have positive anabolic effects on joint health and integrity in athletes. A German study looked into the effects of collagen supplements on athletes' joint pain. For 12 weeks, 100 athletes aged 15 to 80 with knee, hip, or shoulder pain were given 10 grams of collagen hydrolysate every day. The subjects were tested to assess pain, function, and movement. Nearly 80% of the subjects reported improvements in movement and discomfort. The research suggests collagen supplementation appears to cause an increase in type 2 collagen and proteoglycan synthesis, providing better joint integrity and lubrication. A 24-week study out of Penn State University evaluated the effects of collagen hydrolysate in athletes with activity-related joint pain. 147 student athletes were recruited and given either 10 grams of collagen hydrolysate or a placebo every day. After 24 weeks, the hydrolyzed collagen group showed much less overall discomfort when resting, walking, carrying objects and lifting weights. In addition, the supplemented group also experienced significant reductions in knee-specific joint pain when walking, running, and changing direction. According to the findings of this study, there is adequate evidence that collagen as a nutritional supplement can help athletes lessen the symptoms of joint pain caused by physical activity. Hydrolyzed collagen has been shown to lower blood pressure and improve metabolic performance in individuals with type 2 diabetes. Both animal and human trials demonstrate improved glucose and lipid metabolism, as well as increased insulin sensitivity. A study published in the Journal of Diabetes and Metabolism evaluated the efficacy of collagen peptides in the treatment of type 2 diabetes. The study recruited 66 male and female participants between the ages of 21 and 50 and separated the subjects into 4 groups, each receiving either 2.5 or 5 grams of hydrolyzed collagen or an equivalent amount of a placebo for 12 weeks. Blood samples were taken every 3 weeks and analyzed for fasting blood glucose, HbA1c, insulin resistance, and fasting lipid profile. The collagen peptide group showed a reduction of 41% in fasting blood glucose, a 27% reduction in HbA1c, and a 41% reduction in insulin resistance. The group taking 5 grams of collagen peptides had a much better improvement than the group supplementing with only 2.5. A study out of Japan investigated the antihypertensive effects of hydrolyzed chicken collagen in patients with high blood pressure. The trial recruited 15 mildly hypertensive subjects and gave them 5.2 grams of hydrolyzed collagen daily for 4 weeks. The participants were not being treated with any antihypertensive drugs and were instructed to continue their daily diet and routine throughout the trial. At the beginning of the study, the subjects had a high systolic blood pressure of 135.8 on average. At the 4-week mark, systolic blood pressure was reduced by 11.8 and diastolic blood pressure dropped by 4.1 points. The researchers found the supplemental hydrolyzed collagen did several things. It reduced plasma renin activity by 30%, inhibited the angiotensin-converting enzyme, and also increased endothelial progenitor cell activity, which is tied to blood vessel repair. There is mounting evidence that collagen peptide supplementation combined with resistance training results in an increase in lean body mass and muscle strength in both healthy individuals and those experiencing muscle loss. The research suggests collagen has at least 3 separate pathways through which it supports muscle gain. Since collagen is rich in arginine and glycine, it supports the synthesis of creatine, which improves both muscle mass and muscular function. It has a positive influence on microcirculation, microvascular perfusion and amino acid delivery, all of which promote muscle growth. Collagen also significantly reduces joint pain, which allows us to train harder and provide adequate stimulus to the muscles. A study investigated the benefits of collagen supplementation combined with resistance exercise on elderly men with muscle loss. This was a 12-week clinical trial that recruited 53 males with an average age of 72 and put them through a 3-day-a-week resistance training program while giving them either 15 grams of hydrolyzed collagen daily or a placebo. The researchers considered fat-free mass the most important measure of the study, but they also evaluated muscle strength and motor control. Both groups saw significant fat loss, increased bone mass, and improvements in muscle strength and motor coordination. In comparison to the placebo group, the collagen-supplemented group gained an extra 1.32 kilograms of lean body mass and lost 1.94 kilograms of fat. The most surprising thing was that the group that took collagen gained 2.18 times more strength and had better motor control than the group that took a placebo. Another study investigated the effects of collagen supplementation paired with resistance training on the protein composition of muscle in healthy, recreationally active men. This was a 12-week study involving 25 young males who followed a resistance training routine that included 3 weekly barbell hypertrophy workouts. Throughout the trial, the participants were given either 15 grams of hydrolyzed collagen or a placebo and were told to take the supplement within 60 minutes after finishing their workout and at the same time every day. Before and after the 12-week training and supplementation period, the researchers took body measurements, isokinetic strength testing, 1-repetition max testing and muscle biopsies. The collagen group exhibited a significantly greater body mass, fat-free mass, and a little more noticeable gain in strength than the placebo group. Muscle samples revealed a considerably higher number of upregulated proteins and pathways linked with resistance training adaptations than placebo. The study concluded that collagen supplementation enhances the muscle building effects of strength training. Now let's talk about how to supplement collagen effectively. More studies are required to elucidate the therapeutic benefits of the different types of collagen. If possible, find a collagen supplement that combines multiple types such as 1, 2, 3, 5 and 10. For skin, hair, and nails, most studies suggest 1 to 5 grams of hydrolyzed collagen daily to be an effective dose. Data shows about 12 weeks of supplementation are required to see results. For osteoarthritis, most studies use between 10 and 15 grams of hydrolyzed collagen daily. Rheumatoid arthritis seems to respond best to a small amount of undenatured type 2 collagen derived from chicken cartilage. An effective dose based on the research is between 20 to 100 micrograms daily. For bone health, most studies use doses between 10 to 15 grams daily. Important cofactors to improve bone density are magnesium, calcium, and vitamin D. Joint recovery benefits seem to happen with doses around 15 grams daily, with larger doses and longer duration of supplementation providing even more benefit. For the treatment of diabetes and hypertension, studies use doses in the range of 5 to 13 grams daily. For collagen's muscle-building benefits, effective doses seem to be around 15 grams. In the studies, collagen was always taken within 60 minutes of finishing a training session. Collagen production in humans requires several cofactors. When you are supplementing with hydrolyzed collagen, make sure to get enough vitamin C, zinc, copper, manganese and lysine. If you have any questions, leave them in the comments below, and remember to like and subscribe for more content. Thank you for watching, and see you next time.